This podcast episode captures the essence of providing factual, objective information on women's health policies in the upcoming election, drawing attention to the impact of voters' choices in 2024. It is concise, it is informative, and it emphasizes the connection between the election and women's healthcare issues. Welcome. I'm Dr. Bola Sogade, a dedicated women's healthcare specialist with a passion for educating and empowering women on all aspects of their health. With years of experience as an obstetrician, gynecologist, and a family physician, I have seen firsthand the complexities and challenges women face in navigating their healthcare journeys. Whether it's addressing maternal health, reproductive rights, contraception, or access to quality care, I believe every woman deserves to be informed, supported, and equipped with the tools to make the best decisions for her health. My mission is simple: to break down the barriers that stand between women and their right to quality health care. From rural communities to underserved populations, I feel deeply charged with the task of ensuring that every woman, regardless of her background or resources, understands her health options and can advocate for herself. Through education and awareness, I strive to make healthcare more accessible and understandable, offering women the knowledge and power they need to lead healthier lives. I am excited to take the role of educator and advocate, using my platform to bridge the gaps in knowledge and healthcare access. I hope to inspire women to become informed, proactive, and confident in their healthcare choices. Let's embark on this journey together, where every question matters and every woman is heard. As a disclaimer, as the host of this podcast and a women's healthcare specialist, I aim to present the facts objectively, without political inclination or bias. My goal is to provide the information you need to make an informed decision about which 2024 presidential candidate aligns with your values on women's healthcare. So today on Cocoa Pods, we are digressing from our usual program to bring you this special election issue. We are diving into the intricate tapestry of women's health, weaving together threads of policy, personal choice, and historical context. In today's episode, we are taking a closer look at where Kamala Harris and Donald Trump stand on crucial women's health issues that touch the lives of ourselves, our mothers, daughters, sisters, granddaughters, and daughters-in-law. Our guide through this discussion includes insight from the American College of Obstetricians and Gynecologists, ACOG, scientific references, and the context of our shared history. Why does this matter? These issues matter because they go beyond policy debates. They shape the future of healthcare access, safety, and autonomy for generations of women. From reproductive rights to mental health support, these choices affect every woman today and tomorrow. So we start with number one: healthcare affordability and access. Donald Trump emphasizes a market-driven approach to healthcare, focusing on price transparency and competition, including a proposal to align U.S. drug prices with international standards. His stance prioritizes market solutions over direct federal intervention, intending to reduce cost through free market competition. However, he has also aimed to reduce the federal role in healthcare by repealing the Affordable Care Act, ACA, which would limit protections for many, especially in essential services like maternity care. His stance could leave both those with resources and those without struggling with access to comprehensive coverage if federal involvement is scaled back. Kamala Harris, by contrast, champions expanded federal support through measures like the Inflation Reduction Act, which caps insulin costs, reduces out of pocket expenses, and enables Medicare to negotiate drug prices. Her approach also includes strong support for the ACA, which extends affordable insurance to millions, benefiting both those who have resources and those who do not. For higher income individuals, the ACA protects against higher premiums due to pre-existing conditions. For lower income women, the ACA's Medicaid expansion provides essential access to free or low-cost insurance, crucial for uninsured populations, including many Black and Hispanic women. So, comparing both candidates, Harris's approach aims to improve access for all women, focusing on reducing financial barriers and providing comprehensive coverage, while Trump's preference for reducing federal oversight could limit access to key services, impacting women with both high and limited financial means. And why does this matter? Affordable healthcare ensures that financial burdens don't prevent women from accessing essential care, supporting the well-being of women in every role. Number 2, reproductive rights and abortion access. Donald Trump supports a state-led approach to abortion, meaning that individual states have the power to regulate or ban abortion as they see fit. This aligns with conservative initiatives like Project 2025 and the Comstock Act, which restrict access to medication abortions and limit the mailing of abortion pills. This approach creates a patchwork of access where a woman's ability to obtain abortion care varies significantly depending on state laws. Kamala Harris, on the other hand, advocates for restoring nationwide protections by codifying Roe v. Wade into federal law. This would reverse the Dobbs v. Jackson decision, which allows states to limit or ban abortion. Harris's approach would enable women in all states to access abortion services, regardless of local restrictions. Her position aligns with the American College of Obstetricians and Gynecologists, which views abortion as an essential aspect of comprehensive health care. Comparing the two candidates, Harris's policies support nationwide access to abortion, benefiting both wealthy and low-income women. Trump's policies have restricted access, making it harder for low-income women to obtain necessary care. And why does this matter? Well, consistent abortion protections ensure equal access for all women. For those with resources, federal protections reduce the need to travel out of state to access abortion services, while for women with limited means, they remove financial and logistical barriers to essential care. Harris's approach aims to create this consistency, while Trump's state-based approach risks reinforcing inequalities in access across the country. So, let's understand Roe, Wade, and Dobbs. These are the key players in reproductive rights history. So, in 1973, Roe versus Wade became a pivotal case in American history, casting a protective light over a woman's right to make personal decisions about her own body. Roe was a pseudonym for Norman McCorvey, a Texas woman who wanted to end her pregnancy but couldn't legally do so under Texas restrictive abortion laws. She brought a lawsuit against Henry Wade, the district attorney of Dallas County, challenging these laws. The case reached the Supreme Court, which ruled in favor of Roe, declaring that women had a constitutional right to privacy that extended to their decisions about abortion. This ruling ensured women across the nation had safe, legal access to abortion for nearly 50 years. But in 2022, Dobbs versus Jackson Women's Health Organization would change that landscape. Dobbs refers to Dr. Thomas E. Dobbs, the Mississippi State Health Officer, who defended a state law banning most abortions after 15 weeks. The Jackson Women's Health Organization, Mississippi's last abortion clinic, challenged this law, arguing it was unconstitutional. When the Supreme Court ruled in favor of Dobbs, it overturned Roe versus Wade, returning the power to regulate abortion to each individual state. This decision created a patchwork of abortion laws across the country, leaving access to this critical health care uneven and uncertain. So let's look at a painful chapter in the history of abortion, the reality of illegal abortions. Before Roe, women in the United States faced grave risks when seeking to end pregnancies conceived by both a man and a woman, leaving the responsibility to just the woman. With legal options unavailable, many women resorted to unsafe, illegal methods. Some tried using sharp objects, others ingested toxic substances, and many turned to untrained practitioners operating in unsanitary back alley settings. These methods led to severe infections, hemorrhaging, infertility, and even death. This harrowing history reminds us why access to safe, legal abortion is a vital aspect of women's health care. Moreover, though pregnancy results from both a man and a woman, society has long placed the burden of cleanup unfairly on women, leaving them to face the physical, emotional, and financial consequences alone. This imbalance underscores why reproductive choice and autonomy are essential for women's well-being. But why would a woman need abortion services in the first place? There are many reasons a woman might need an abortion, and it's important to view these decisions with compassion and understanding. Here are some common reasons, explained in a positive and supportive way. Number one, health concerns. Sometimes continuing a pregnancy can seriously endanger the woman's health or even her life. In these cases, abortion may be necessary to protect the well-being of the mother. It's a way for women to make the best decision for their own health, especially if their life is at risk. Number two, fetal health problems. Some pregnancies involve serious medical complications where the fetus, the unborn child, has conditions that would prevent it from surviving after birth. In such cases, women may choose to have an abortion to prevent further suffering for themselves and the baby. Number three, personal or financial readiness. Some women may feel that they are not in a stable situation, whether financially, emotionally, or personally, to raise a child. They may choose abortion as a way to make a responsible decision for their future and for the well-being of any existing of future children they might have. Number 4, pregnancy from trauma. In the unfortunate cases of rape and incest, some women may choose an abortion because the pregnancy is a result of a traumatic event. In these situations, allowing women to make their own choices gives them control over their bodies and their healing processes. And number 5, for family planning, abortion, rightly or wrongly used, can be a part of a woman's plan to ensure she can provide the best life possible for her family. For some, this means waiting until they are more prepared to have a child, either emotionally, financially, or in terms of their support system. In all these situations, the decision to have an abortion should be made thoughtfully with care for both the woman's health and her future. And it's about giving women the ability to make choices that are right for them based on their unique circumstances. So, going back to the candidates, we talk on the issue of contraception access and family planning. Donald Trump's administration allowed employers to deny insurance coverage for contraception based on religious or moral beliefs. It was framed as a protection of religious freedom, but this policy prioritized the employer's values over the employee's healthcare choices, allowing organizations to decline contraceptive coverage if it conflicted with their beliefs. Supporters saw this as a boost for personal choice and religious freedom in the healthcare space, though critics felt it limited individual healthcare options. Additionally, Trump's administration cut federal funding for Title X. Title X is a program that funds affordable family planning and preventive health services for low-income communities. So, by cutting this funding, they restricted options for women relying on Title X clinics for low-cost birth control if they lack employer-based insurance. His administration's emphasis on transparency in healthcare costs was also intended to help individuals navigate pricing across providers, potentially benefiting those who pay out of pocket for contraception by making affordable options easier to find. Kamala Harris, in contrast, advocates for expanding access to contraception for all women. She supports over-the-counter, that is OTC, birth control options and pushes for insurance coverage that removes out-of-pocket costs, benefiting both women who prefer the convenience of over-the-counter access and those who rely on Medicaid or other subsidized insurance for affordable birth control. Expanding over-the-counter options for birth control, however, raise clinical considerations. Without a healthcare provider's guidance, women may choose contraceptives that don't align with their health needs, especially if they have conditions like high blood pressure or a history of blood clots. Additionally, the lack of medical supervision could lead to inconsistent or improper use, reducing the effectiveness of over-the-counter birth control. And skipping regular checkups could result in missed screening for reproductive health. To address these issues, Harris's policies aim to balance access with education and guidance to support safe, informed contraceptive use across all socioeconomic backgrounds. So, comparing both candidates, Harris's policies seek to remove barriers to contraceptive access for all women, promoting autonomy and affordability in healthcare choices. Trump's approach, while focused on religious freedom and cost transparency, has limited access for women relying on employer-provided insurance or Title X funded services, placing more emphasis on organizational choice over individual access to family planning. So why does this matter? Well, accessible, affordable contraception is essential for women's autonomy, allowing them to make informed decisions about family planning, health, and their futures. So, number 4 topic, maternal health and addressing disparities. Donald Trump's administration took a significant step by passing the Preventing Maternal Deaths Act, which set up committees across states to study and address maternal mortality. This initiative provided some groundwork for understanding the issues contributing to maternal mortality rates. But Trump's platform has not emphasized additional maternal health reform or specifically addressed the racial and socioeconomic disparities that continue to impact many women. Trump's broader healthcare policies, such as efforts to repeal the Affordable Care Act, could have affected maternity care access, especially for low-income women who rely on Medicaid for prenatal and postnatal services. Kamala Harris has placed a focused emphasis on maternal health, particularly for Black, Native American, and rural women who experience maternal mortality at disproportionately higher rates. Her support extends to initiatives like the Maternal Care Act, which seeks to reduce racial biases in maternal health care and improve healthcare outcomes. Additionally, Harris advocates for extending Medicaid coverage for up to 12 months postpartum, aligning with the American College of Obstetricians and Gynecologists' recommendation for comprehensive care that addresses both physical and mental health needs during the critical postpartum period. Harris's policies aim to improve health equity by ensuring that all women, regardless of income or background, have continued access to maternal care that promotes long-term health. Comparing the two candidates, while Trump's administration laid a foundation for maternal mortality review with the Preventing Maternal Deaths Act, his broader platform has not focused on maternal health reform or reducing disparities. In contrast, Harris's policies prioritize both expanded maternal health coverage and reducing racial biases in healthcare, aiming for systemic improvements in maternal health for all women. And why does this matter? It matters because safe and equitable maternal health care is essential for the health and futures of mothers across the country. Harris's focus on addressing disparities seeks to provide this protection for all women, helping to ensure that maternal health does not depend on race or income or location. Number 5, rural healthcare access. Donald Trump's administration temporarily expanded telehealth services during the COVID-19 pandemic, which allowed rural residents to connect with healthcare providers remotely, reducing travel burdens and providing critical access to care during emergency restrictions. However, this expansion was not designed to be permanent, and Trump's broader healthcare policies did not focus on long-term solutions to support rural healthcare infrastructure. Once the emergency measures ended, many rural communities were left with limited access to consistent health care, relying heavily on distance and affordability to determine care options. Kamala Harris, in contrast, advocates for making telehealth a permanent healthcare option in rural areas to address long-standing access issues. Telehealth allows women in rural communities to connect with healthcare providers, including specialists, without the need for extensive travel. In areas like Forsyth, Georgia, Transportation barriers present a significant challenge for women needing prenatal and women's health services, with limited public options and high costs for private transport. For these communities, Harris's policies on telehealth could mean a lasting, accessible healthcare connection. One example of expanded access is our own very OB-GYN birth center in Forsyth, Georgia, which made history by delivering the first baby in the area in 45 years. This birth center continues to serve women facing access issues, offering them quality prenatal and delivery services close to home in a region where access to such care has long been limited. This local presence is especially crucial in an underserved community where access and distance are frequent barriers. So this approach benefits women with resources in rural areas who gain more convenient access to specialists through telehealth, and also benefits low-income and minority women who face additional transportation barriers and are now able to access care more easily from home. So comparing the two candidates, Harris's policies support a permanent expansion of telehealth as a sustainable healthcare solution for rural areas, aligning with the American College of Obstetricians and Gynecologists, which endorses telehealth as a way to close healthcare access gaps for women in underserved regions. Trump's temporary expansion provided relief during the pandemic, but did not establish telehealth as a lasting, accessible option for rural healthcare needs. So why does this matter? Well, rural healthcare access affects all women, those with and those without resources, impacting healthcare outcomes across these communities. Long-term telehealth is a vital bridge enabling women in rural areas to access timely care that might otherwise be out of reach due to distance, finances, or transportation limitations. So going to the sixth item, mental health integration in maternal and reproductive care. Donald Trump's platform does not prioritize mental health integration in maternal and reproductive health care. So while the Trump administration made strides in other areas of health care, it lacked a specific focus on ensuring that mental health services are incorporated within maternal care. This gap can leave many women without the necessary mental health support during critical periods such as pregnancy and postpartum, where depression and anxiety are prevalent. Mental health remains an essential but often underemphasized component in maternal health care policy under Trump's approach. Kamala Harris, by contrast, places a strong emphasis on integrating mental health services within maternal health care, including dedicated screening for postpartum depression. Her approach aligns closely with the American College of Obstetricians and Gynecologists, which underscores the importance of addressing mental health as part of comprehensive women's health care. The American College of OBGYNs advocates for mental health screening and ongoing support to be integrated throughout the maternal care continuum, emphasizes that untreated mental health conditions could have profound effects on mothers and their families. Harris's platform aims to make mental health care accessible and integrated, particularly during the prenatal and postpartum periods, to ensure that women receive the comprehensive care they need. So comparing both candidates, Trump's platform does not emphasize mental health integration within maternal and reproductive care, focusing more broadly on healthcare initiatives without a targeted approach on maternal mental health. Harris, on the other hand, strongly supports mental health integration aligning with ACOG's recommendation for mental health screenings and services to be standard components of maternal care. Why does this matter? Mental health is integral to overall health, and accessible support ensures that women, whether mothers, daughters, or granddaughters, can live full, healthy lives. By incorporating mental health services into maternal care, policies can create a supportive system that protects not only women's physical health, but also their emotional well-being during life's most significant stages. Number 7, the use of technology to advance care. So, and we've talked a little bit about this, but Donald Trump's administration did support the expansion of telehealth services during COVID-19 pandemic, allowing more people to access healthcare remotely when in-person visits were challenging. However, this support was largely limited to emergency measures, and Trump's broader healthcare policies did not prioritize telehealth as a long-term solution. His administration's focus on reducing federal involvement in healthcare also limited the potential for permanently integrating telehealth technology to expand access, especially for underserved populations in rural or low-income areas. This approach emphasized temporary relief rather than sustained improvements in healthcare access through technology. Kamala Harris, on the other hand, advocates for making telehealth a permanent feature of the healthcare system, recognizing its value beyond the pandemic. Harris sees telehealth as a way to expand access, especially for women who face barriers like transportation costs and lack of nearby healthcare providers. This approach benefits a range of women, those with resources who appreciate the convenience and time savings of telehealth, as well as low-income women and also minority women who can avoid travel expenses by accessing care from the comfort of their home. Harris's vision for telehealth aligns with the American College of OBGYN, which supports the use of telehealth to improve accessibility to healthcare, particularly for prenatal and reproductive services. ACOG highlights telehealth as an effective means to address healthcare disparities and increase timely access to care for women in rural and underserved communities. So comparing both candidates, Trump's support for telehealth focused on short-term pandemic-related needs. Harris' policies promote telehealth as a sustainable solution to bridge healthcare gaps. Her approach aligns with ACOG's stance on the importance of technology in enhancing healthcare access, particularly for women who face geographic or socioeconomic barriers. By aiming for long-term telehealth integration, Harris's policies seek to provide lasting benefits across diverse communities. And why does this matter? Technology, like telehealth, has the potential to transform healthcare access, making essential services available to all women, regardless of location or financial status. Ensuring permanent access to telehealth supports the health and autonomy of women in both rural and urban settings, creating a more inclusive healthcare system that adapts to the needs of modern communities. And number 8, support for survivors of domestic and sexual violence. Donald Trump's administration faced criticism for rolling back protections for sexual assault survivors, particularly in educational settings. These challenges reduced certain protections for students reporting harassment or assault, raising concerns that the rollbacks limited resources and justice avenues for those affected. This approach was seen by many as a step backwards in supporting vulnerable individuals in school and workplace environments, potentially discouraging survivors from coming forward. Kamala Harris, in contrast, has a long-standing history of advocating for survivors of domestic and sexual violence. As a prosecutor and later as a senator, Harris has supported stronger protections for survivors, working on legislation aimed at preventing violence and ensuring that survivors have access to justice and support systems. Her policies seek to expand protections across all settings, focusing on enhancing resources for survivors and implementing comprehensive support services. So the American College of OBGYN also advocates for strong protections and healthcare services for survivors of violence, emphasizing the importance of trauma-informed care. ACOG supports policies that foster safe, accessible resources for survivors, including holistic care that prioritizes safety, dignity, and well-being. This aligns closely with Harris's approach, which emphasizes comprehensive, survivor-focused support within both healthcare and legal frameworks. So, comparing both candidates, while Trump's policies allowed for reduced protections in educational settings, limiting support and resources for survivors, Harris's policies advocate expanding survivor protections across all areas, aligning with ACOG's commitment to providing trauma-informed care and robust support services for those affected by domestic and sexual violence. Why does this matter? Well, ensuring robust protections and support systems for survivors of violence is essential for the dignity and safety of all women in our communities, supporting mothers, daughters, sisters, and granddaughters alike. Aligning policies with the American College of OBGYN's commitment to trauma-informed care provides essential pathways for healing and empowerment, ensuring that survivors can access the resources that they need. Number 9, addressing racial and socio-economic health disparities. Donald Trump's platform does not specifically address healthcare disparities related to race or socioeconomic status. While his administration focused on broad healthcare reforms, there was no targeted approach to mitigate the significant maternal and reproductive health risks faced by marginalized communities, particularly Black, Native American, and low-income women. This gap in the platform meant that the unique challenges faced by these communities, such as higher maternal mortality rates and limited access to prenatal and reproductive health services, were not directly addressed. We're broadcasting from Forsyth, Georgia, that stands at number 49 of 50 in ranking for maternal mortality in the United States. Kamala Harris, in contrast, has placed a high priority on tackling racial and socio-economic health disparities, especially in maternal and reproductive health. Her policies, including the Maternal Care Act, aim to reduce racial biases in healthcare and improve access to essential services for underserved communities. Harris advocates for expanding Medicaid postpartum coverage for up to 12 months, aligning with recommendations from ACOG. American College of OBGYNs stresses the importance of extended postpartum care to improve health outcomes for all mothers and supports policies that close gaps in healthcare access, particularly for marginalized groups who face higher risks and fewer resources. So, American College of OBGYN stance has consistently advocated for equitable healthcare access, emphasizing the importance of addressing racial and socio-economic disparities in maternal and reproductive health. They highlight that marginalized communities face significant risks, including higher maternal mortality rates due to structural inequities in healthcare. ACOG calls for policies that eliminate these barriers, promote unbiased care, and expand access to preventive services, which align closely with Harris's focus on ensuring equitable health care for all women. So, comparing the two candidates, while Trump's healthcare approach did not specifically address the disparities that affect marginalized communities, Harris's policies focus on reducing these gaps, especially in maternal care, aligning with the American College of OBGYN's call for equitable healthcare access and unbiased treatment for all women. Why does this matter? Equitable healthcare ensures that all women, regardless of race or income, have access to quality care and support. Addressing disparities lays a foundation for a healthier, more inclusive future, providing necessary resources for all women, including those in marginalized communities, to thrive and receive the care they need. Number 10, balancing federal versus state control of healthcare. Donald Trump has emphasized a state-led approach to healthcare, preferring to let individual states set their own standards on issues like abortion and healthcare funding. This approach allows states to make decisions that align with local values and priorities, but it also results in inconsistent healthcare access and protections across the country. While these policies support state autonomy, it can mean that access to healthcare services, including abortion, varies significantly depending on where a woman lives. One potential benefit of this approach is that it provides states with the flexibility to innovate in healthcare delivery, though this flexibility often comes at the cost of uniform access. Kamala Harris, by contrast, advocates for federal protections in healthcare to ensure consistent access and quality of care across state lines. She believes that a woman's right to healthcare, particularly reproductive healthcare, should not depend on her geographic location. Of mention is the control at the state level of freestanding birthing centers, allowing states to regulate free birthing centers without adhering to Federal Emergency Medical Treatment and Labor Act (EMTALA) laws can lead to serious disparities and risks in patient care. EMTALA mandates that anyone coming to an emergency department must be stabilized and treated regardless of their insurance status or ability to pay. This federal regulation exists to ensure equitable and immediate access to critical emergency services, particularly in labor and delivery scenarios, where timely care is essential for the health and safety of both mother and baby. When states regulate freestanding birthing centers independently, ignoring EMTALA protections, there is a risk that certain centers may not provide the same level of emergency support or seamless access to hospital services in critical situations. This creates gaps in care, especially in rural or underserved areas where freestanding birthing centers may serve as the primary point of care for pregnant individuals. Without adherence to EMTALA standards, states could potentially impose transfer agreements or regulations that limit the ability of birth centers to operate effectively or refer patients in emergencies, ultimately compromising patient safety. A state-led approach that bypasses EMTALA may also result in varied standards across states, leading to inconsistent access to emergency care. Women in one state might have access to federally supported emergency protocols at freestanding birthing centers, while women in another might not, depending on state policies. Federal EMTALA standards provide a crucial safety net, ensuring a minimum standard of care that can protect mothers and infants from preventable harm due to delayed or denied emergency services. Like in the state of Georgia, when strong hospital lobbying groups use their influence to block freestanding birthing centers from securing transfer agreements, the issue often stems from economic motivations. Hospitals viewing freestanding birthing centers as competition for maternity and birth-related services may leverage their influence to protect market share and revenue by denying essential transfer agreements. This practice not only hampers the operation of freestanding birthing centers, but also puts patient safety at risk by creating delays in emergency situations when swift transfers are critical. State regulations may allow this kind of economic suppression, enabling hospitals to exercise control over smaller healthcare providers like freestanding birthing centers, as is being done in the state of Georgia. However, a federal mandate, such as those provided under EMTALA, could prevent this by ensuring that all patients, regardless of their location or the facility they initially visit, have guaranteed access to emergency services. Federal intervention could disallow economically motivated restrictions, focusing instead on patient welfare by mandating that freestanding birthing centers have fair access to hospital support when needed for urgent care. This dynamic highlights the importance of federal oversight to prevent monopolistic practices in healthcare, as state-level regulation alone may not prioritize patient access or public health. By enforcing a federal mandate that guarantees freestanding birthing centers the right to establish transfer agreements, we could create a more equitable and safe healthcare landscape for expectant mothers and families, especially in rural and underserved areas as we are in Forsyth, Georgia. So comparing the two candidates, Trump's state-centered model allows states to customize healthcare policy, but it often leads to a fragmented system with varying levels of access, as we see in Forsyth, Georgia. Harris's approach, on the other hand, seeks to establish federal standards that provide consistent healthcare protections for all women, reflecting ACOG's stance on the importance of nationwide access to reproductive healthcare. Why does this matter? A woman's right to healthcare should not be determined by her zip code. Federal protections ensure that healthcare access and quality are consistent across the country, supporting the dignity, health, and autonomy of all women, regardless of location. And then number 11, the last but not the least, the long-term impact on generations of women. So Donald Trump's approach to healthcare emphasizes state control and free market principles, prioritizing individual choice and market-driven solutions over federal intervention. This model promotes personal responsibility and local governance, but can limit access to affordable healthcare options for vulnerable populations, including women who rely on comprehensive reproductive and mental health services. Supporters argue that this approach can reduce government intervention and allow innovation in the private sector, but it risks leaving some women with fewer protections and fewer options for essential services. Kamala Harris, in contrast, advocates for federal protections and expanded access to healthcare, particularly in reproductive and mental health. Her platform seeks to ensure that essential healthcare services are accessible and affordable for all women, including those in marginalized communities. Harris's focus on comprehensive care, especially in areas like maternal and mental health, aligns with the American College of OBGYN's recommendations to address long-standing gaps in women's health. This approach aims to shape a healthcare system that provides security and support for generations of women, ensuring that future mothers, sisters, and daughters can access the care they need. So comparing the two candidates, Trump's policies prioritize limited government involvement, emphasizing free market choices and local control, while Harris's approach centers on federal protections, affordability, and expanded access. Trump's model may offer flexibility, but Harris's approach is aimed at creating a consistent, equitable healthcare framework that serves all women, especially those facing economic and geographic barriers. And why does this matter? The healthcare policies chosen today will shape the future for generations of women. This election is pivotal in defining a legacy of healthcare that provides support, choice, and security for mothers, daughters, granddaughters, and future women who deserve a strong foundation of health and well-being. So, the key takeaway for voters on women's health in the 2024 election. Number one, on reproductive rights. Kamala Harris supports national abortion protections, advocating for federal consistency that ensures all women have access to abortion services, regardless of location or income. Her stance aims to protect women across socioeconomic background, providing both affluent and low-income women with more consistent access to care. Donald Trump prefers a state-regulated approach, aligning with restrictive measures like Project 2025 and the Comstock Act, which make abortion access more difficult, particularly impacting women with fewer financial resources who cannot afford to travel for services. So comparing both of them, Harris's policies provide nationwide protections, while Trump's approach results in varied access depending on state laws. And this matters because consistent access to reproductive rights ensures that all women have autonomy over their health care, regardless of geographic or economic barriers. On healthcare access, Kamala Harris works to expand the Affordable Care Act and Medicaid, aiming to make healthcare affordable and accessible for a wider range of women. Her support for federal involvement ensures that women, especially in lower income brackets, receive essential care. Donald Trump has focused on market-driven healthcare solutions, reducing federal control and emphasizing price transparency and competition. However, his efforts to repeal the Affordable Care Act would reduce access to key healthcare services for low-income women who rely on Affordable Care Act protections. So comparing the two candidates, Harris's approach broadens access to affordable care, while Trump's reduces federal oversight, potentially limiting essential coverage. And this matters because accessible healthcare enables women to make informed decisions for themselves and their families without financial strain. On maternal health, Kamala Harris prioritizes addressing racial and socioeconomic disparities in maternal health, particularly benefiting low-income and minority women. Her support for the Maternal Care Act aims to improve maternal outcomes across communities. Donald Trump's policies have not emphasized maternal health reform, although his administration did pass the Preventing Maternal Deaths Act to create review committees on maternal mortality. So while Trump's administration established a framework for studying maternal health, Harris's policies aim for comprehensive reform, particularly targeting vulnerable communities. And this matters because equitable maternal health ensures that all women have safe, quality care throughout pregnancy and postpartum, reducing racial and socioeconomic health disparities. On contraception access, Kamala Harris advocates for accessible and affordable contraception, including over-the-counter birth control and federal policies that remove out-of-pocket costs, making contraception more widely available, though over-the-counter birth control can be clinically problematic. Donald Trump permitted employers to deny contraception coverage based on religious or moral grounds, reducing access for some women, especially those dependent on employer-based insurance. So comparing the two candidates, Harris supports broad contraceptive access, while Trump's policies place more control in employers' hands, potentially limiting coverage. And this matters because affordable access to contraception allows women autonomy over family planning and personal health, regardless of employment status. On rural healthcare access, Kamala Harris supports permanent telehealth expansion to increase rural healthcare access, helping address logistical and financial barriers. Her policies ensure that women in remote areas can access specialists without needing to travel. Donald Trump's administration expanded telehealth temporarily during COVID-19 pandemic, but did not prioritize permanent support for telehealth post-pandemic. And comparing the two candidates, Harris advocates for lasting solutions in rural healthcare, while Trump's approach was more temporary. And why does this matter? Reliable telehealth access in rural areas and even in urban areas can transform healthcare for women who may otherwise lack access to timely medical attention. And then on the issue of technology in healthcare, Kamala Harris promotes telehealth as a lasting feature in healthcare, improving access to care for women across various locations. Donald Trump supported telehealth expansion during the pandemic, though his approach was limited to short-term emergency responses. And comparing the two candidates, Harris views telehealth as a permanent solution, aligning with ACOG's endorsement of telehealth to reduce healthcare disparities. And why does this matter? Technology like telehealth supports women's access to care by overcoming geographic and financial barriers, particularly for those in underserved regions. The references that we used: number one, the American College of Obstetricians and Gynecology, ACOG. Number two, KFF, Women Voters Revisited, Abortion, Inflation, and Healthcare in 2024, available at www.kff.org. Number three, the Commonwealth Fund, Healthcare on the Ballot in 2024, available at www.commonwealthfund.org. NPR, Medicaid and Healthcare Expansion during the 2024 election, available at www.npr.org. Brookings Institution, Abortion Rights in the 2024 election, available at www.brookings.edu. ACE USA, A Guide to Candidate Positions, Abortion Rights in 2024, available at www.ace-usa.org. Healthy Women, Where Kamala Harris and Donald Trump Stand on Women's Health Issues, available at www.healthywomen.org. And my final thoughts as we approach the 2024 election. It is evident that Kamala Harris and Donald Trump offer distinct visions for women's health care. Their policies on reproductive health, reproductive rights, healthcare access, maternal health, and more present voters with contrasting choices that will shape the future healthcare landscape for generations. Each voter must reflect on their values to determine which candidate aligns best with their views on women's healthcare. It is my hope that the next administration will do everything they promise they will do and will work actively to improve healthcare access, equity, and quality for all women across the country. So to our listeners out there, thank you for listening to Cocoa Pods podcast. Stay informed, ask questions, and hold leaders accountable. My name is Dr. Bola Sogade.